Unless you've been living under a rock, you've been hearing about Ozempic. But instead of following Hollywood trends, follow me so I can tell you more about this medication, why it's so helpful, and if it's for you. Hey, I'm Steph Wagner. I am a dietitian specializing in obesity management, including patients who've had bariatric surgery or are utilizing an obesity management medication like Wegovy, which is actually Ozempic. Ozempic is a diabetes medication, but it's kind of become like the KLEENEX of medications for weight management. So people will be Googling Ozempic, or you'll hear jokes or memes or anything about Ozempic, but the FDA approved medication is actually Wegovy. So Wegovy is semaglutide, so is Ozempic. They have different doses, whether it's for obesity or for chronic weight management. So this video is actually not technically about Ozempic. It's actually about Wegovy because it is the next medication I wanted to review in this series on FDA-approved medications for chronic weight management. The first video I went through all 6, but now I'm kind of slowing it down and going through these medications in more detail. So Wegovy is a once-a-week injection of semaglutide, and it is a GLP-1 receptor agonist. Not necessarily something you need to know unless you really like to get into the weeds on this, but you'll notice in the next video when I talk about Saxenda, it's a similar medication, but it's a daily injection, and it kind of started things off. So once Wegovy came to the scene, it's a once a week injection, and the average percent of weight loss is like 15 to 21% of weight loss. Well, when that came out, that is the most effective medication that we've ever seen for weight management. Before that, it was kind of like bariatric surgery or phentermine, but now we have 6 different FDA-approved medications, and I recently went over Zepbound. It is the most effective FDA-approved medication at this moment, but Wegovy is just right behind it. They're both really effective medications, and sometimes patients will tolerate one more than the other, or maybe supply is an issue, so maybe they will research which medication is easier to get the prescription filled and go with that one. Either way, the best doctor to work with is an obesity medicine doctor. So if you don't know if your bariatric program offers something like that, check with them first. But then if you need more help finding a provider, go to obesitymedicine.org and use your zip code to find a doctor that specializes in obesity management. For bariatric surgery patients, a medication like Wegovy may be really helpful if you've had weight reoccurrence or you've really plateaued and you're well past your first year after surgery and you're not seeing further progress. The FDA says that these medications are indicated if the BMI is above 30 or 27 above with a weight-related comorbidity. So if you have had bariatric surgery, it's been well beyond a year, and you're having weight reoccurrence, or you have not continued weight loss and you're still above a BMI of 30, then it may be appropriate to utilize a medication like Wegovy. Like the other GLP-1 medications, the cost is high. A lot of insurance companies do not cover the medications, and they can be over $1,000 a month out of pocket. And the medications are recommended for long-term chronic weight management. There may be instances where a patient could lose weight and then titrate down and maintain their weight loss, but for a lot of patients, going down on a medication means they will have weight reoccurrence, which means $1,000 a month. Maybe you could afford that for a little while, but can you afford that every month? Long term, that is where the question lies. So when it comes to coverage and insurance reimbursement, that's where hopefully the Treat and Reduce Obesity Act can really help us out. I'm the policy and advocacy leader for the Weight Management Practice Group with the Academy of Nutrition and Dietetics. It's a really long way to say that I'm involved in policy that will help improve access to care for obesity. And that means TROA is a bill that would increase access to dietitian visits for patients on Medicare and access to medications for obesity management. TROA has a lot of co-sponsors on that bill. We're really hoping to see it push forward. If it does, a lot of private insurance companies follow what Medicare does. So it's possible if we get TROA pushed through, we can start seeing more coverage overall for obesity management medications. You can find out more on a link below. The Obesity Action Coalition is a great website to advocate and follow when it comes to access for obesity treatment. Wegovy, of course, like the other medications, is FDA approved with healthy eating and exercise. So definitely a time to work with your dietitian, which they can help you manage symptoms. Medications like Wegovy can cause nausea, vomiting, abdominal cramping, diarrhea, constipation, headaches, fatigue. Majority of those things can be improved with eating behavior changes, food changes, tweaks in your diet, timing of your meals, how much fluids. Usually whenever we fix these little things, we can manage symptoms, maximize nutrition, and get the most out of that medication. But it is different for everyone. It's not a one size fits all. So I can't totally make a video that's just like, this is exactly what you should eat on one of these medications, because it is very different. But in a lot of ways, it's helping you get back to what you're trying to do. So if you've had bariatric surgery and you know that we're focusing on protein at 3 meals a day and getting your hydrated fluid in between your meals and getting fibrous veggies, then the medication is just going to help you to do that. So it's not like we're totally reinventing the wheel with what you should be eating, but hopefully the medication is helping you to actually do that more consistently in the long run. But sometimes those symptoms come in and we might have to tweak what you eat and when you eat it to make sure that you're feeling your best while you're on the medication. I've also noticed there's going to be a lot of noise in this area because Ozempic has become such a big splash. And it's a booming industry. There's a lot of money, opportunity, and everybody wants a piece of their pie. So you might see all of a sudden ads for Nature's Ozempic and how you can take these natural medications. And that's not true. Some of those natural ones, maybe they have there's one ingredient that might help increase the GLP-1 a little bit, but it's going to be like negligible because the medication is GLP-1 receptor agonist. It's mimicking GLP-1. These Nature's versions are, they're not the same thing. So be really careful when something says Nature's Ozempic. It's not the same thing. The other thing is that there's a lot of ads for different weight loss programs that are also using GLP-1 medications like Noom or Weight Watchers. And I'm not saying that it's all bad. I think that there can be some good there, but we have to really put our blinders up and weed through some of this stuff. I saw an ad for Noom recently that said Ozempic doesn't have to be forever. And then it was marketing their Noom program. And would say there's two things I would disagree with that. And for one, Ozempic is not FDA approved for weight loss. It's for diabetes. So they're using Ozempic as, again, kind of the KLEENEX name, but technically they're talking about diabetes medication. Well, you should be taking your diabetes medication long-term if you have diabetes. But also, even if you're talking about Wegovy and saying Wegovy doesn't have to be long-term, well, like I said, for some, that might be true, but for the majority of people, it does need to be long-term. So I think we have to be really careful when all the different ads and information come in around the medications, because there will be claims around it that aren't all based in facts. So it's a noisy world out there. There's exciting things going on with these medications. If we can get supply and cost figured out, and if we can quiet the noise around some of the peripheral things with the medications, but it's going to be a wild ride. Buckle up, stick with me, subscribe to my email newsletter so you can keep informed with videos like this on medications or other ways to manage weight recurrence after bariatric surgery. And thanks for watching.